guys know how the MRI works, by the way, as far as the technology of that too? With that magnetic field, okay, what it does is there's hydrogen atoms that are attached to all the different atoms or the molecules in our body. Well, the hydrogen atoms, the way they're attached to the molecule, they have certain angles of attachment. When you turn a magnet on, as powerful as these magnets are, those hydrogen atoms go into a certain alignment. Okay, then they shut the magnet off. Those hydrogen atoms then go back to where they were. When they do that, they actually release energy. And that MRI machine picks up that energy that's being released, and a computer once again interprets that information into an image. So that's how you get the pictures. So MRI kind of has a similar look to a CAT scan, but it's not radiation. Okay, typically it's a little deeper. Okay, it still has a little bit of a tube concept to it, but it's basically a large magnet coil around this hole that the patient goes into. And then from that magnet, it gives you images. Okay, similar concepts, works like a bread slicer, horizontal, vertically, and gives you those images. The key with an MRI is that it, one, doesn't have radiation because it's a magnetic field. Two, is that it's looking for soft tissues, and it's very good at picking up water. And why that's important is when you have an injury, think of any injury you've had, you get swelling associated with that. Well, if you have a recent injury, an MRI can pick up the water or the swelling or edema in that area and tell you that something's just happened, whether it being old or new. Okay, so that's the very sensitive for acute trauma here. Okay. Disadvantages, again, the pacemaker, aneurysmal clips, metal flakes in the eyes, things like that are a problem. All right, T1, T2, these are just different sequences and how they set up the MRI machine as far as showing you pictures. In this sequence, you see the fluid's dark, the spinal nerve roots and spinal cord are lighter. There's your discs, there's a herniation right there. That's a problem. Okay, that's a problem. And then over here in T2, you see the same sort of thing. But you can tell now if you were to get a CAT scan on this, you can't see any of this material and you cannot see that going on. So you can get a CAT scan, everything looks fine, but that's just not the real story there. All right. Here's the cross-sectional images now. Here's a nerve root on this is actually the right side over here, and the left is over here. So that's a disc herniation right there, pushing on the nerve root, getting squished right underneath here. Same thing over there. Okay, just different sequences, T1 and T2. All right, now do you see the difference between an MRI and a CAT scan, putting them side by side? So, typically we see in a lot of we get a lot of CAT scans we see. The ER tends to like to order CAT scans when patients have neurologic issues or back issues. And we're not really sure why they do that. I mean, obviously for fracture, that makes sense. The patient has a fracture here, there's a fracture up here, there's multiple fractures in this patient. So CAT scan to look at the bone details appropriate, and getting an MRI, then you see that the nerve's getting pinched right there. Okay, gives you a much better look at that. But when patients come in with non-traumas that have leg pain, back and leg pain, a CAT scan is relatively useless because it's not going to show you what you need to see. Exposes the patient to radiation, and you got to get the MRI anyways, so it doesn't really help you a whole heck of a lot. The only time we really need to use CT scans is in trauma, looking at bone detail. When we see what the fracture looks like, where are these pieces of bone in preparations for surgery, or what do they need done as far as treatment's concerned. All right.